Hello, my name is Tia Pinnock. I'm the Communications Lead for NHS Practitioner Health. Today I'm really excited to be here with Dr. Clare Gerada, who is our Medical Director, who's kindly taken some time out of her busy schedule to answer a few questions that will be to highlight and raise awareness to suicide prevention. Clare, how are you doing?
Very well, Tia, and nice to see you.
I mean, between, seeing patients, support groups and writing a book, it's been a bit mad. How have you been managing?
Yes, and leading a charity, Doctors in
Leading
Distress,
as
which
well.
I'm very proud of.
Yes.
And the royalties from my book, which is coming out in a month, called Beneath the White Coat, Doctors, Their Minds, I better say that again. My book, which is coming out next month, Beneath the White Coat, Doctors, Their Minds and Mental Illness, the royalties for the first year will all be going to my charity.
Oh, that's amazing. That's great. I'm looking forward to when the launch comes. Have we confirmed the launch? Is it the 8th of October, the launch?
Yes, it is the 8th of October. Brilliant. COVID pending.
COVID pending, definitely. Okay, so we'll just go dive right in and just fire away. Is that okay?
Absolutely.
Okay, so in regards to suicide rates in doctors and health professionals, do you feel that it's higher within them or in the general population?
Thanks, Tia. This is a question I'm often asked, and it's actually very difficult to find proper studies. Studies do suggest that doctors have a higher rate of suicide than their matched population, especially female doctors, where the rate of suicide is between 2 to 5 times the rate of women in the general population. Whether, though, in men it's higher or lower is difficult to say, and I suspect in male doctors, looking at the evidence, it's probably about the same as the general population.
Okay, that does make sense. You've kind of covered just briefly there why this might be. Do you feel anything else why that might be in regards to the population between?
Well, we also have to say that doctors should have a lower rate of suicide than the general population if you take risk factors into consideration. So on the whole, doctors are well educated, they tend to have good social networks, they have a high status job and are usually well paid. So we should have lower rates. So the very fact that we have the same or higher is very worrying, and it does suggest that there is something inherent in the role of being a doctor that makes doctors at risk of suicide, and I firmly believe there is something within the role of being a doctor that makes us more at risk. It's not just how we're chosen, because doctors are professional, they're perfectionists, but I think it's also the work we do, and being exposed to death, disease and disability on a daily basis, of course, impacts our mental health. And if we don't have spaces where we can talk about the emotional impact of our work, if we physically and emotionally take it home with us and fret about it, then those who aren't as well supported as others may actually become depressed, and some sadly may take their own life.
Yeah, no, that's understandable. It is always, we always say sharing is caring. So, for those of you that obviously are struggling or finding it difficult, you find a way to try and speak to someone on anything that you are struggling with. What might stop a health professional speaking up about their suicidal thoughts?
Yes, suicidal thoughts are common. Suicidal thoughts are not uncommon here. I would imagine that most doctors listening to this will have had some thought around taking their own life, possibly in the last year. What's important is to be able to articulate the distress behind those suicidal thoughts and be able to have spaces where you can actually talk about what's going on, and talk about the death of a child that you had to go to last week, or the failed resuscitation, or the 30 patients that are really causing you sort of anxiety because you can't meet their needs. That's what the important issue is to be able to take those thoughts to a safe place, to be able to talk about them, uncluttered by people making notes and revalidation and appraisal and whatever, but just with peers, ideally in a facilitated space.
Okay, that's great. How can we start conversations and speak to someone we are worried about?
If we're actually worried about a colleague, it is difficult to start that conversation, but it is important. And I think the first thing to ask is, how are you? And actually wait for the response. And if they say, well, I'm fine, you say, oh, you don't look fine, actually. I noticed that you're looking a little bit sad, or you're a bit anxious, or you've been a bit irritable lately.
Yeah.
Do you fancy a cup of coffee or a cup of tea? Now, clearly, during COVID, this is very difficult because we're not having face-to-face contact with our peers. When we do have face-to-face contact, we're on the whole covered in PPE, or we're 2 meters apart and not being able to meet in those same spaces. But that's what makes it even more important that we ask those questions and are interested in the responses. And if you are worried, really worried, then just say to the person, I'm really worried about you. Do you want to talk about this?
Yeah. Okay. And then just finally, what message would you like to give to doctors and other health care professionals on World Suicide Prevention Day?
What message can I give? If you're really seriously thinking about taking your own life, talk about it. Talk to someone who loves you. Talk to a relative, a friend, your doctor. Ring the Samaritans. Contact my service at practitionerhealth.nhs.uk. Speak to someone. I promise you, there is nothing worse for those left behind than having a relative who has killed themselves. Your life is more important to many people alive than you're feeling now. Please seek help.
Claire, that was great. Well, I really hope that those questions and answers help those out suicidal thoughts or anything else that they're going through at the moment. And like Claire said, if you like to access the service, please visit our website at www.practitionerhealth.nhs.uk. Claire, thank you. Enjoy the rest of your
Pleasure.
and thanks again.